You're listening to the ReThink Health Podcast, hosted by Dr. Marius Geanta and powered by the Center for Innovation in Medicine, a European research and innovation organization. Through this podcast and the ideas expressed by our guests, we want to build forward better and to set the stage for the European Health Union, one in which the Eastern voice is also heard.
So welcome everyone to the ReThink Health Podcast with my guest, Professor Richard Sullivan. Hello, Richard. Thank you so much for being with us today.
My pleasure. Thank you for asking me.
We are with the right person at the right time to discuss about the implication of the war in Ukraine, because Richard is director of the Institute of Cancer Policy, but as well the co-director of Conflict and Health Research Group at King's College in London. As well, NCD advisor to the WHO and the civil military advisor to Save the Children. And Richard's interests in terms of research focus on global cancer policy and planning and health system strengthening, in particular in conflict ecosystems. So once again, I think we have in front of us the right person to make us understand what are the health implications in near, medium, and long term of the war in Ukraine. But first of all, I will start by asking you, Richard, to say a few words. What are your thoughts now regarding what happened in Ukraine from your perspective?
The war in Ukraine, the Russian invasion of Ukraine has been has had an appalling impact on health and the healthcare systems there. I mean, first and foremost, I think most people will understand this, that there's been really no sparing of either civilian areas or indeed healthcare facilities. We've seen attacks against healthcare facilities. We've seen attacks against humanitarian convoys and corridors as well. So if anything, it's illuminated yet again massive violations in international humanitarian law. And I think this is probably one of the things that, the ICRC has been saying for years, that wars now are happening and people are ignoring the rules of war. So we're seeing, very, very direct damage and death, calls to civilians, non-combatants. The second thing we're seeing, of course, is a very rapidly changing situation. And I have to say, even when this podcast goes out, the situation will look very different from where it is today. So the information, the intelligence we have on the state of healthcare within Ukraine is understandably fragmented. It's very protein. It's changing every single day. And of course, Ukrainian healthcare professionals and colleagues of ours there are having to adapt to the needs on a day-to-day basis. And this is, you have to remind people, this is a fully demographically transitioned country. So these are a country with already high levels of burden in terms of non-communicable diseases. And on top now, of course, they're having to deal with a lot of trauma from the war itself. So the situation is changing very, very dramatically day to day. The ability to continue working in these conditions is very variable. First of all, patients have to be able to get to facilities, and obviously that has been cut in many areas. If we look at what's happening in terms of the invasion of the Russian forces through the north, through the east, through the south, entire areas entire oblasts like Sumy, for example, are simply impossible to move around without being hit by airstrikes or artillery. And then secondly, we're talking about having supplies go to the hospitals to be able to continue treatment. And obviously main supply routes are now being cut to many parts of the country.
You explained, I think, very well what are the challenges in front of the healthcare professional as well of the patients that are currently in Ukraine. We'll discuss a little bit later on about the neighboring countries, because you mentioned that actually in Ukraine there are some demographic and health indicators that are not so good, but I think it's the case as well for other countries in the region, for Romania, our country, for Moldova as well. But first, I would like to ask you about this overlap between the pandemic and the war. Knowing that the vaccination rate is low in Ukraine, is as well low in the neighboring countries. As well, the death rates attributable to COVID is one of the highest actually in the region. How do you see this overlap and the implications?
Yeah, I think it's just reinforced what we're seeing more and more in the globe today, which is the overlap between conflict on one hand and high threat infectious diseases on the other hand. We've seen this in Africa, of course, with Ebola. In many countries in Africa that have had outbreaks of Ebola, in Mozambique, in Eastern Congo. We see these what we consider to be complex emergencies with conflict happening together at the same time. So as you said, we've still got COVID outbreaks going on across both host countries and Ukraine. The hard reality is, though, now that is no longer a healthcare priority in any of these settings. You're essentially dealing now with the immediate impact of the war itself, which is basic humanitarian assistance, water, sanitation and hygiene, immediate reproductive and maternal health, and immediate infectious disease. And by that, I mean infectious diseases with antibiotics tend to be bacterial infectious diseases. The idea that there's going to be any ability to distribute any forms of vaccination is simply out of the window at the moment. What that might do to a resurgence is hard to tell at the moment. And even if there was a resurgence, I doubt we would actually know, because patients now obviously, developing moderate or severe COVID in many parts of the Ukraine have nowhere to go. So either they will recover from it or they will then end up dying at home. So it's a huge problem, and it illuminates again what happens when conflict happens in the context of an ongoing pandemic, as you said.
So we should expect actually for a new variant of SARS-CoV-2 to somehow to emerge. I don't know if in Ukraine or in the countries with a lot of migrants coming from Ukraine. What do you think?
It's unlikely. I mean, it never helps. This sort of, let me be blunt, conflict by and large is very bad news for infectious diseases. It drives infectious diseases. It is one of the major drivers of antimicrobial resistance as well, for a variety of reasons. But in terms of the general threat of new variants, there's no more of a threat occurring in Ukraine as there is of this emerging in Latin America or somewhere in Europe. But Let me be blunt, it doesn't help.
Let's discuss a little bit about the migrants, because there are actually millions of people migrating from Ukraine first to neighboring countries, to Poland, Slovakia, Moldova, Romania, and Hungary. But there are now, when we discuss about 10% of them already in other European countries, in Western countries. So I think we have a new situation across Europe, in the European Union, with more than 2 million people today coming from Ukraine, who actually are looking for a new life, for new jobs, are seeking care at a certain moment. We don't know what is the vaccination status. They have their own cultural and behavioral, baggage with them. How do you see this challenge from the, let's say, Western Europe and maybe European Union perspective?
Well, let me first say, I think there's two populations to be concerned about. So the first, I think, within Ukraine, we have, of course, massive internal displacement. It's what we call internally displaced people. A lot of people now moving to Western Ukraine, where the fighting is, of course, far, far lower. They bring their own healthcare challenges. A number of cancer centers and other healthcare centers are still operating, places like Lviv, etc. So there's going to be a huge pressure on those Western oblasts within the Ukraine. Then, of course, we're seeing, of course, week on week, day on day, very large increases in terms of UNHCR capture of Ukrainian refugees. By far, the biggest number at the moment are moving into Poland. But the problem with that is that you have to be a little bit careful saying that's the biggest impact country, because when you look at the numbers moving even into Hungary, Romania, Slovakia, Moldova, when you look at it as a percentage of their overall country, these are still very large numbers moving in terms of the impact on the health systems. And the immediate neighboring countries are at very different levels of healthcare system development and capacity. We know, for example, Poland has, in my particular domain of work, cancer care, has a very centralized cancer care services. They've got well-organized Polish oncology societies. They're already providing information sheets and navigation to refugees coming across the border who have been already diagnosed with cancer. That is a world away from Moldova that, of course, is coming from a very different level of healthcare system development. And they're already being overwhelmed by the sheer numbers coming into their country. So what you're seeing then is a very different levels of the ability to engage with and help refugees within contemporary healthcare systems. They've all been incredible in the sense of being extremely welcoming, providing free treatment, etc. But of course, this is as you said, it's a temporary measure here. And the question is, how much longer can those countries cope without getting additional financial assistance? And how big a burden are they going to have to cope with as refugees settle? And the question in everyone's mind is, settle for how long? Is this indefinite now? I mean, this is a war that could potentially last not just months. This could actually end up in years. And we have absolutely no sense at the moment of what's going to happen. And then your other point is absolutely right, that a lot of refugees are coming into countries and then moving out again. We've seen this in Romania, Moldova, and they're being distributed and they're moving around Europe. Again, I think the overall burden is yet to be seen. And the reason for that is, by and large, refugee movements like this take about 6 weeks to 8 weeks to stabilize out in terms of the pathways that they will take to where they settle. They may have friends and family, they may just go where the refugees are going, or this may be a managed process with individual countries. So each country is going to have to work out how to absorb the refugees within their own individual healthcare systems. And again, I think the ability to do this is about, the creativity. It's also about the financing. Places like the United Kingdom and Germany have much deeper pockets than Romania and Slovakia. And I've been saying again and again, it's absolutely essential that the EU, and it's already started doing this, provides the sort of funding that's going to be needed. But this could be a very long-term financial commitment to these countries. And I think it remains to be seen how exactly they're able to cope with this. I think at the moment we're in the emergency phase, but we have to start rapidly planning for the intermediate phase, settled status. And also, let me be blunt, the war will come to an end, and one day I'm absolutely convinced Russia will be gone from the Ukraine. The question is, how then do you help Ukraine rebuild its healthcare system? And that is, of course, a very long distance strategy, but something that it's never too early to start thinking about.
Yes, it's not too early, especially for you I know that you have been involved in Afghanistan, actually, in defining the basic pocket for medical services as well. You have been involved in Pakistan, in dealing with polio and so on. You mentioned Moldova earlier. Now, when we discuss 5 out of 100 people who are now in Moldova are actually migrants, which is a very high percentage. And indeed, we think that the pressure on the health system in the neighboring countries will increase in the weeks to come, as well in the context of coming back to the normal from the pandemic perspective. And we know, and the European Cancer Organization actually showed the data last year about the impact of the pandemic on the cancer, with a lot, 1 million cases that actually were missed last year. What we should expect from the chronic diseases perspective, cancer, but also I think we should discuss about the cardiovascular diseases, what we should expect.
Excellent question. I think this could rapidly overwhelm a lot of the healthcare systems, even with the best will in the world, even if a lot of money is found very quickly. And I maybe explain to your listeners about this is, just simply the money is found does not necessarily mean overnight you can build another hospital or magic out of nowhere 20 new cardiologists or 20 new oncologists. The issue really comes down to the fact that healthcare systems take a long time to build up. You might be able to provide immediate emergency support to people. That's very easy to do. But chronic diseases require a level of complexity in hospital care that is not like a tap you can turn on and off. And I think there's a big, big issue here about how many patients these countries can actually handle. And I wouldn't be surprised if this now becomes a major factor in asking the question, how do we redistribute refugees from Ukraine around Europe? Because it's not just simply what is fair and what a country can handle. We're talking about the carrying capacity of a country's healthcare system. And in many cases here, this has never really been factored in. It's just accepted under UNHCR, the refugees settle in the first country of origin, and that's where they stay. I think in this case, where you're having complex NCD care needs and where the burden increases, it's going to overwhelm the carrying capacity. And I think even offering Moldova, I don't know, I'm exaggerating it, 100 million to provide NCD care will not allow them to magic out of nowhere 20 respiratory consultants, 20 cardiologists, etc. In the immediate term, there may be ways of being a little bit clever with task shifting, with bringing external doctors in to help manage those patients. But I think you have to think of that only as a temporary solution rather than a solution for the kind of what I would call longer term. And I think the other thing to say is that somewhere along the line, you have to decide what your basic package of care is. I think there's going to be an expectation that there's often what we do is we oversell what we're going to be able to manage in terms of chronic diseases. Are we talking about paying and managing for renal dialysis? Are we going to provide complex cardiac surgery? Are we going to provide very complex cancer care? Or are we going to say, look, we're going to provide basic package of NCD care, and this includes the following things. And that is, that's a harsh clinical triage reality, but it's designed really to provide the most support to the most people in the most affordable manner. And I'm afraid that's just going to be one of the realities.
Indeed, and especially with this long COVID, and we know that there are a lot of cardiovascular complications as well, neurological, coming from the high number of people infected with the virus in the last two years. This is in addition to, let's say, the traditional cohort of the NCD patients, and now we have the cohort of the NCD patients. Most of them are elderly people, actually. Going to neighboring countries, so it's a really big challenge.
Yeah.
And I'm afraid that, of course, at the moment, the health system as well in Romania and other countries, the decision makers said that any migrant who might need access to healthcare is free of charge. Just present to the hospital, and we'll take care of this. But I think it's not sustainable on the medium and long term. And you're totally right that you have to have a plan for this. Maybe it's too early now to discuss about this, but it's something that we should have in our mind. I have one, let's say, do you want to add something on this, Richard?
I guess the plan is the important bit, and maybe I would almost say you're absolutely spot on. And I would start modeling and planning right now about what the likely scenarios are. I think we know what Russia's intent is. It seems like they are not, and unless something remarkable happens, they look like they are fully intent on dominating the Ukraine. And I think, one has to plan for the worst, actually. If it's better than that, that's fine. But if you plan for the worst, you know what then you can expect. And it's never too early for European leaders to start having those discussions now. It's not something, I think the individual healthcare facilities can only manage this at the tactical level and plan for what's coming through their door, and plan through informal networks. But at the government level, the Ministry of Health level, these conversations have to happen now. And that's what we learned from the Middle East. The mistake was made that we didn't plan early enough about what the impact was going to be and how to manage it.
So we from the region, we should push for decision maker at the EU level and national level to start working on a plan for the medium and long term, and the time is now. I said that I would like to discuss a little bit with you about innovation, because you are as well involved in a lot of projects with different types of innovation. I'm sure that is not the right time, in the time of war, to discuss about innovation. But speaking about plans, about how to rebuild the Ukrainian health system, but as well, I think the health system in the neighboring countries. How do you see this intersection of the pandemic, now with the war, a lot of innovation, and European priorities like cancer?
Yes, it's a great question. I think you have to be, I think what it's going to expose is there is a gulf between technological innovation improving patient outcomes and population outcomes versus the health system. Technologies will only work and are only so good as the hands they're put into and the systems in which they work. And I think there's been a tendency of the EU to simply look at new medicines, new surgical technologies, new types of health, new digital health technologies as good public goods in and of themselves without considering the context, i.e., we've trained enough doctors, we've trained enough nurses, they're high enough quality in terms of how they operate, and we have good enough services and systems to deliver those. In other words, the governance, the pathways of care are there. And I think this is going to be one of those moments that in a world where there was lots and lots of money, you could probably get away with allowing things to develop in an ad hoc manner and not consider how these three vectors intersect. But we're no longer in that world. The post-pandemic period is going to be a period of enormous economic contraction. The mere fact that we've now engaged in this very, very dramatic economic escalation against Russia in terms of turning off the oil tap and no doubt downstream the gas tap as well. That's going to have serious economic consequences as well. When you put all of this together, we're going to have to do an awful lot more with an awful lot less. So there are some very, very clever, digital technologies that have come along. I mean, it makes me laugh in a sense because people talk about digital technologies, and I say to them, one of the greatest innovations in healthcare with WhatsApp, actually being able to take a group together and be able to talk to your colleagues in the Ukraine, Poland, Slovakia simultaneously. What do you think of this patient? Where can I send them? And do it instantaneously like that. It's been amazing for this informal care. But, we know now in Poland, for example, that they're using technologies for geolocation to help Ukrainian patients who speak no Polish because they don't know where they are. They can't read the signs, but they can have a phone to be geolocated. Electronic medical records. I mean, that's a big issue. Loads of cancer patients are turning up in Poland, Romania, Moldova, Romania. They have no notes with them. They have no idea how they've been treated. And cancer centers are having to literally go back to the beginning and rework them up. So how do you provide the notes to patients electronically that they carry from country to country? So there's lots of innovations within a crisis and refugees. But as you're speaking to your question about development and downstream development, the focus is really going to be on, in my view, human resources, physical infrastructure, and systems. The technology is easy. And I'm going to be honest with you, I'm going to say that again. The technology is easy to get. It's really hard to get the right numbers of human beings that you've trained up. It's really hard to put in place the systems and the governance. It's not even very difficult to build a new hospital. It's very difficult to staff a new hospital. It's very difficult to put in place the pathways and the governance of a new hospital. It's not difficult to procure. Once you've got all those elements in, you can procure surgical supplies, cancer medicines, radiotherapy equipment, CT. So I think it's going to make us focus a lot more on systems and the whole idea of this implementation side, that it's about healthcare workforce.
My final question, actually, I would like to ask you to send a message to the medical students, to the pharmacy students, to the young professionals from Ukraine. Some of them contact already us and probably will be part of our team at the Center for Innovation in Medicine. But what is your message for them? Because they have some professional dreams, maybe. They someday dream to work in an European environment. And now with the war, this dream actually should wait a little bit. What is your message for that?
My message is one of absolute solidarity, to say to them that there is a future, that there are an awful lot of us out there who are thinking about them on a daily basis, that we're going to be here to help long after this war has ended, because there's going to be an enormous amount of capacity building that's going to be needed to rebuild Ukraine and put everything back in again. And then for them not to lose hope or lose their dreams. People like yourself and others around neighboring countries and around Europe have been absolutely fantastic in terms of the solidarity and support. What's happening is essentially a crime against humanity to Ukraine. Let's be absolutely clear. And I'm pleased that we stand shoulder to shoulder with them. But I think, my key message is not to lose hope, that there is a future, and the future for them is going to be very bright.
Richard Sullivan, thank you so much for being with us today. Richard, expert in health and as well in conflict from King's College of London. I'm sure that is just our first conversation because, as you said, I think the war, we don't know when will end, but I'm sure that the situation actually and the crisis will continue for many years, I think. So thank you once again, Richard, for joining us today.
No, my pleasure. Thank you for talking to me.
You listen to the ReThink Health Podcast, hosted by Dr. Marius Geanta and powered by the Center for Innovation in Medicine, a European research and innovation organization with interest in visionary health policies and civil society education. Through this podcast and the ideas expressed by our guests, we want to build forward better and to set the stage for the European Health Union, one in which the Eastern voice is also heard. The war in Ukraine, overlapping with the health crisis caused by the pandemic, changed our lives overnight, once again. We are all rediscovering the fear and the uncertainties of just 2 years ago, from the first days of the pandemic. We have a health crisis, but it is completely different from the pandemic health crisis. Naturally, not only health, but individual safety, from all points of view, has become and is now our main concern. At the Center for Innovation in Medicine, we are aware not only that we have not returned to pre-pandemic normalcy, but that we have entered the new post-pandemic normalcy. We are experiencing a new reality. Science and innovation do not stop because the war has begun. And nor will we.